we have in the house also some of the survivors of the experimentations. And will y'all brothers please stand? Okay, so any questions that come up, y'all can feel free, to step in. Now, Alan Lawson here, he's an old soldier, comrade of mine, and he was with us back in '74 when we went together, him and Bud Chauffeur, to Washington to testify in Congress to have it stopped. And we did that. That's when they passed the National Research Act. Where it's at now, I don't know. We have copies of it, but the point is they just overriding everything. Maybe it's because Bush was in there. I don't know. But, we got a job to do, and we're going to do it last man standing. So the floor is open. Each individual can have about 3 minutes. Yes.
Thank you for being here.
Introduce yourself, please.
My name is Numa St. Louis. I'm a political reporter for Radio Haiti. And I have a question for the panel. First, I want to thank you for putting this wonderful and historical event. I'm just curious if the panel can touch... You and the survivors.
Yes,
correct.
Sir.
I stand corrected. Can you guys draw some parallels in terms of similarities between what they endured relative to the Tuskegee Airmen?
Tuskegee Airmen? Now the Tuskegee syphilis experiment.
Yes,
right,
that's what I was implying.
Okay.
I can actually, if you guys don't mind, it's kind of the tie-in I feel that pretty much allows me to be here to speak with you guys today. As the gentleman alluded to, in 1932, the United States Public Health Service, today known as the Centers for Disease Control and Prevention, committed one of the most heinous crimes in our country's history, where for over 40 years, they basically left African American men from resource-poor community, Macon, Alabama, untreated. And syphilis itself is a bacteria. It's a sexually transmitted disease that, if left untreated, can cause irreversible damage to one's internal organs or death. So it's very serious. Before HIV and AIDS came, as we know it today, syphilis was the big bad wolf, okay? So the tie-in in terms of what I wanted to speak with you all today about what's happening here in Philadelphia is what I call, ironically enough, Tuskegee North, okay? And that is basically the selective enforcement of disease control and the intentional abandonment of care. Similarly to Tuskegee 1932, the CDC, Philadelphia Department of Health, is ran and managed by the Centers for Disease Control and Prevention, basically neglected the hierarchy of disease control. And the hierarchy of disease control, real fast, is a pregnant female with any type of communicable disease. A pregnant female with any communicable disease, a person with HIV/AIDS, a person with syphilis, gonorrhea, chlamydia. So if you have a pecking order, the hierarchy again would be any female with a communicable disease, STD, okay? And as a disease investigator, which I was employed as a disease investigator for the Centers for Disease Control and Prevention, assigned to the National Rapid Response Team, which is consisted of the 25 top disease intervention specialists in the nation. Our job is to effectively go out and find that woman and to prevent her from, or to make sure she gets treated so we prevent her baby from being born with syphilis. And you do that sort of like Saving Private Ryan style. At any means necessary, you want to make sure that doesn't happen. And just kind of give you, and not to take too much time, just kind of give you an idea. In 2008, there were one congenital death. That's a woman who had syphilis, who was not contacted and informed and notified in a timely fashion. This baby was born with syphilis. There were six total cases. In 2007, there were 10 total cases of congenital syphilis. Syphilis is an incendiary device for HIV/AIDS. Anybody with syphilis is 5 times more likely to contract or expose someone else with the HIV virus. It's very, 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 very deadly, okay? So in essence, there is a correlation or a connection here today with the lack of efficiency or urgency in terms of making sure that minority and ethnics or their disease control and prevention efforts are addressed in a timely fashion. Okay, this isn't about white or black. Okay, this is about right and wrong. And in essence, we're here today to attest that this needs to stop.
Yeah, well, it was.